So stroke is obviously a very devastating and debilitating disease, and it affects a large number of Americans every year. There are a lot of different causes for stroke, but one of the more common ones are blockages in the arteries going to the brain, where these blockages and these plaques can actually kind of flick off and go to the brain, causing the stroke. The most common type of stroke is an ischemic stroke, where there's lack of blood flow to an artery in the brain. Treatment options depending on which vessel is affected and where it is affected. The testing to look for blockages in the carotid artery is actually very simple and very painless. It is a simple ultrasound that is done on the neck, and that is the best screening modality to determine whether or not you have blockages in your carotid arteries. The lifestyle modifications for stroke patients are similar to heart patients. Those include eating healthy foods, eating heart-healthy foods, stopping smoking, controlling your underlying risk factors, which happen to be high blood pressure and diabetes, which are the most common lifestyle modifications that need to be done. Atherosclerotic disease, this disease we're talking about, doesn't affect just one artery, doesn't affect one segment of the body. When it affects the heart, it also affects the legs, and affects the arteries to the intestine, affects the arteries to the brain, and the arteries in the brain as well. And so the same kind of lifestyle modifications you would make for heart disease are helpful in other vascular diseases as well.